Electronic devices are becoming an integral part of our lives today. Laptops, computers, and mobile devices are a common sight for most households today. These digital devices have made work a lot easier and even brought about a paradigm shift in a world of entertainment. As a result, this led to a high reliance on them, and more people are spending a large portion of their time on these digital devices. Therefore, complaints such as eye strain, eye fatigue, and even headaches have become the common complaints which plague most of the population today. Through extensive studies, these complaints have been linked to the prolonged exposure to blue light, which is emitted from sources such as the screens of digital devices and artificial lightings. Blue light, which possesses wavelengths that range from 400 nanometers to 500 nanometers, constitutes part of the visible spectrum. When visible light enters the eye, the blue wavelength is focused in front of the retina. This causes the eye to constantly try to maintain its focus and adds significant pressure to the eye's energy expenditure. Through innovations and research, computer lenses offer the solution to reduce blue light for our environment, which is emitted from sources such as the screens of digital devices and artificial lightings. Even when outdoors, you're not free from the effects of blue light, as it is found everywhere. Standard lenses allow the full visible light spectrum to pass through them, without filtering out the excessive blue light. The cause is eye strain and fatigue. Computer lenses reflect blue light with its unique coating, allowing you to enjoy benefits such as less eye strain and enhanced color contrast for a totally new visual experience.
Did you know? Every day, whether sunny or cloudy, and throughout the seasons, we're exposed to dangerous UV radiation from the sun. Driving, running errands, and even a fun day on the slopes, any outdoor activity requires smart, protective eyewear. You may be surprised to know that fewer than 1 in 3 people realize the hazards of UV radiation to the eyes, and children are most at risk, as they receive up to 3 times the annual sun exposure of adults. The radiation cannot be seen or felt. UVA and UVB rays can cause short and long-term damage to the eyes, including sunburn of the eye, cataracts, and even cancer. UV damage over time cannot be repaired. Everyone needs outdoor eye protection. Protecting your eyes from the sun's harmful UV rays is simple. Always wear quality sunwear with UVA and UVB protection when outdoors. Sunglasses are the perfect accessory. Not only are they a necessity while outdoors, they look great and are fashionable too.
Less than 15% of kids have actually had their eyes examined before starting school. It's shocking because 80% of learning is visual, it's through our eyes. So these kids are struggling with misdiagnosed as having behavioral problems, attention problems, when a big component to what's holding them back is a vision-related learning difficulty. 2020 is important, but there's so many other things that we've interfered with in terms of your skills, your ability to get information, your ability to process that information.
When a person has chronic dry eye, inflammatory changes in the tear-producing glands and in the eye's surface can interfere with the production of normal tears. When this occurs, the eye produces fewer tears that are less effective. This results in a tear film that evaporates more quickly than normal, which provides less moisture and protection for the eye's surface. With the tear film's protection diminished, the eyes may experience painful symptoms of dry eye, and damage to the eye's surface may occur. Dry eye is more common among people over age 40, and especially among women around the age of menopause. Patients with systemic inflammatory conditions, such as rheumatoid arthritis, lupus, rosacea, or Sjogren's syndrome are also at risk. Certain medications can worsen dry eye and its symptoms. These can include certain medications for the treatment of depression, high blood pressure, allergies, hormone replacement therapies, and diuretics. While they are not the root cause of the condition, environmental factors including air pollution, dry weather, and persistent wind can worsen the symptoms of dry eye. Heating and air conditioning can create similar environmental conditions indoors. Everyday activities such as driving, reading, focusing on a computer screen, or watching television can also worsen dry eye symptoms.
If your eyes are itching, tearing, burning, or red, you may have eye allergies, or what doctors call allergic conjunctivitis. Allergies develop when the body's immune system becomes sensitized to something such as pollen, dust, pet dander, or mold. These are called allergens, and there are many potential allergens in our environment that can come into contact with our eyes. With allergic conjunctivitis, allergens cause the eyes and surrounding tissues to become inflamed and uncomfortable. These symptoms may occur alone or in combination with general allergic symptoms, such as coughing, sneezing, or a stuffy nose. There are two main types of eye allergies, seasonal and chronic. Seasonal eye allergies are the most common form and occur in the spring or fall, when the amount of pollen in the air is very high. Chronic eye allergies are less common, but potentially more severe than seasonal allergies. This form is non-seasonal and occurs continuously throughout the year. Chronic eye allergies may be triggered by dust, mold, pets, or other allergens that are present year-round.
I'll tell you a little bit about some of the custom lenses that we make that go with all these great looking frames that you'll see behind me here. Just like a pair of shoes, or you wouldn't wear the same pair of shoes for everything that you do. So there's hundreds of lenses on the market, and each of those lenses solve different issues for you. We have the light active ones that when you go out in the sun they change. We have the Verilux, the progressive lenses that cover all the different reading zones when you look far away to up close, and an array of other specialty lenses that fall in between there. And as the master optician and lab manager here for the office, spent years learning about those lenses, and when it comes time for you to think about solving your vision care problems, you don't really have to know all of that product information. You come to us and we'll help you work through all those many choices to get you just the right pair. We have computer pairs for when you're at the office and you're having trouble with the computer, your tablets, your phones, all of those things in your life that may give you some concern when you're sports and active, running. Do I have a bifocal in my custom sunglasses? You know, we help you work through all those issues, and we're going to find just the right lens to fit just the right frame. And we start by looking at the prescription. Of course, everyone loves the frames, they're beautiful, but we want to make sure that that combination of the lens and the frame together give you the perfect fit and the perfect vision. We want you to see great and look great as well.
I went for my first eye exam in many years and learned not only did I need glasses, but I also needed bifocals.
More than 2 million boomers have glaucoma, and another 2 million have the disease but don't know it. More than 30 million Americans aged 40 and older suffer from eye disease. Many new cases are curable or preventable by detection through an annual comprehensive wellness exam.
More than 1 million Americans are blind. The 4 common causes are cataracts, glaucoma, age-related macular degeneration, and diabetes. This is normal vision. This is with cataracts, this is with glaucoma, this is with macular degeneration, and this is with diabetic retinopathy. And if left untreated, they can all end up looking like this.
Contacts might change more than just your vision. Dominguez Bello and other researchers from NYU's Langone Medical Center found significant differences in the ecosystems of the eyes of people who wear contact lenses and those who don't. They had 3 times the usual proportion of certain bacteria like methylobacteria, lactobacillus, and Pseudomonas bacteria in their eyes. Basically, the bacteria on the surface of their eyes looked more like the types of bacteria found on their skin.
Trauma, infection, inflammation, and lack of oxygen can cause blood vessels to grow into the cornea. This condition is called corneal neovascularization, and if left untreated, can lead to vision loss and other serious complications. Corneal neovascularization is often associated with excessive contact lens wear, especially in patients who do not wear their lenses according to their prescribed wearing schedule. Treatment for corneal neovascularization depends on the severity of the condition. It can range from a reduction in wearing time to discontinuing lens wear completely.
Trouble-free lens wear starts with healthy eyes. For the best experience with your contacts, always follow the wearing schedule the doctor gives you. Clean and care for your lenses, and get a yearly checkup.
Zia Vision was founded with one mission: to fight vision loss and preserve healthy vision through superior nutraceutical products and measurement devices. The I Promise brand of nutraceuticals contain of dietary zeaxanthin, derived from all-natural paprika. The I Promise brand of nutraceuticals include Restore, which replicates the natural 2-to-1 ratio of zeaxanthin to lutein in a healthy fovea, along with other essential vitamins and nutrients. Easy Tears, a supplement for dry eye that contains 8 anti-inflammatory ingredients to attack dry eye from the inside.
talk to you a little bit about Specialty Sports sun lenses. And as the lab manager and master optician here at the Eyewear Gallery, I've spent years studying these types of lenses, so I'll be able to help you pick out just the right lens and just the right frame no matter what your sport is. We cover a range when we do sports from far away to all the up-close vision that you need, and this is going to help you really get your best vision and perform your best in whatever sport you're doing. So we've got some high technology that we use to help really pinpoint the way the frame fits and to help us pick out just that right lens as well. So no matter what your needs are out in the sun, we've got just the frame.
Crizal lenses reduce the eye strain and discomfort associated with computer screen glare. They minimize the effects of harsh lighting or prolonged TV viewing, like dry, burning eyes. Less glare means improved concentration and visual comfort at work, at home, or anywhere.
Golfers worship it and curse it. From the deep shadows of morning to the glare of high noon. Light is everything out here. Transitions lenses enhance contrast by helping reduce glare so you can see clearly in all light conditions while helping protect your eyes from the harmful UV rays of the sun. Go on, live your vision, out here and everywhere. Ask your eye care professional today about Transitions lenses.
Just look at the difference a new Crizal lens with Scotchgard protector can make on your sight. Neither rain, nor snow, nor dust, nor dirt, nor smudge, nor scratches, nor glare of night can keep your lenses from giving you the clearest vision possible. New Crizal lenses with Scotchgard protector.
With normal, healthy vision, everything you see is clear and in focus. Many people refer to this as 20/20 vision. You can see all objects clearly, whether they are close up or in the distance. This is a normal, healthy eye. In order to see, there must be light. Light reflects off an object and enters the eye. The light passes through the clear covering on the eye called the cornea that helps focus light through the pupil. Next, the light passes through the eye's crystalline lens, which constricts to help light rays focus on one point on the retina, resulting in clear vision.
Experiencing extreme glare. Xperio polarized lenses recommended. With Xperio, experience clarity like never before.
Wow, that is clear. But maybe I'll go for a drive.
Warning, extreme glare delays reaction times. Xperio polarized lenses recommended. With Xperio, experience safety like never before.
Or maybe I'll go for a hike.
Natural color rendering off. Xperio polarized lenses recommended. With Xperio, experience beauty like never before. You require polarized lenses that not only deliver superior UV protection, but also eliminate bothersome glare, making your world more safe and more beautiful.
stereopolarized lenses are recommended.
Now, do you know where you got those sunglasses?
At a convenience store.
At a convenience store. Let's think about that for a moment. A convenience store sunglasses. I'm sure they're top quality.
Oh yeah.
Yeah. Now, do you think, okay, they're shaded, they're dark lens, so they must be protecting my eyes?
I hope so.
Yeah. Well, I don't know if hope's gonna cut it, Chad. Here's the deal. You have to have a UV protected lens. Otherwise, yeah, you might as well just be, you might take the lenses out and just wear the frames. Now, see, here's the thing. A lot of people don't understand that they don't have to be colored. Even a clear lens, as long as it has UV protection, is just as good. Did you have any idea?
I had a sticker on it when I bought it.
Well,
that went to the trash.
An exam that doesn't always identify all vision problems. Each year, thousands of young adults suffer from undetected vision problems that can make school and life difficult. Many are misdiagnosed as having a learning disability, or ADD. Young adults with poor vision may struggle to read, have short attentions, perform poorly in sports, and develop low self-esteem. The solution is an annual eye exam at your eye doctor. Get corrected.
A major complaint about glasses is the glare and halo effect experienced with nighttime driving. Crizal enables you to react faster and feel safer behind the wheel. It cuts down on the reflections and glare from headlights and other light sources.
Open-angle glaucoma is the most common form of adult glaucoma and can lead to loss of vision or blindness. This type of glaucoma can only be detected by your eye care practitioner through a routine eye examination. Open-angle glaucoma occurs when the eye's drainage system becomes clogged over time. A part of this system, called the trabecular meshwork, is a tiny spongy tissue that allows fluid to leave the eye. This structure is situated in the eye's angle where the iris and cornea meet. When this drain becomes clogged, aqueous fluid cannot leave the eye as fast as it is produced, causing the fluid to back up. This backed up fluid increases pressure in the eye and can cause damage to eyesight. If open-angle glaucoma is not diagnosed and treated, it can cause a gradual loss of vision. This type of glaucoma develops slowly and usually without symptoms. For more information, ask your doctor about open-angle glaucoma.